Good morning, Peter Goertz. I'm a psychiatrist. Does taking medication throw off your natural biochemistry? If we're taking medicine, and conversely, if we're prescribing medicine, we're intervening in a natural system. So we're potentially at least altering the balance of naturally occurring chemicals, hormones, etc. Now, is there a way of intervening in the system without throwing off the natural biochemistry? Yes, to my knowledge. Breathing techniques, for example, can have a positive effect on your natural biochemistry. But if someone is acutely ill, let's say with a stroke, that may not be the way to go. What brought this up to me was yesterday I was on call in the hospital and I saw a patient really suffering from acute opioid withdrawal, curled up in the fetal position on a stretcher, vomiting, really not feeling well. And that brought home to me the notion that intervening in a natural system biochemically, whether it's illegal drugs, legally prescribed drugs, foods, supplements, vitamins, all that can shift the system and potentially have unwanted effects. An example would be benzodiazepines. If someone's taking benzodiazepines longer term and wants to stop them, let's say Valium, Ativan, etc., that can really be a challenge. And when we're starting a medicine, we're changing the system, we're altering the system, and creating a new balance, basically. And the same thing on the other end, if we're tapering off or stopping a medicine, we're altering the balance again of the natural system. So things like that can be time-consuming and also quite difficult physically and emotionally for patients. Analogously, with an SNRI, let's say Effexor or Cymbalta, stopping that, tapering off can be very challenging. SSRIs can be difficult to taper off. If someone receives testosterone injections, there can be, of course, an alteration in the natural system, in the system of biochemistry of the body, and that can lead to testicular atrophy. So we really want to be aware as patients, as doctors, of the consequences of what we're doing when we're intervening in a natural system. If we're prescribing Synthroid, and I was just reading, apparently one opinion is that Synthroid is prescribed too often nowadays. But if we're prescribing Synthroid, thyroid hormone, that can have, of course, biochemical effects, can lower the TSH, which we want when we're prescribing Synthroid. But again, it's an example of changing the biochemistry of the body. If someone has been on clonidine and stops it abruptly, they can have severe hypertension. So clonidine withdrawal can cause dangerous hypertension. Medications can alter the gut microbiome, which can have effects, of course, on the biochemistry. So bottom line, we want to be mindful when we're adding a medicine, we're creating a new balance in the biochemistry of our bodies, and that can take time for that to equilibrate, so for that new balance to be creative. And the same happens, or analogously, when we take away a medicine, when we taper off a medicine, we're again creating another new balance, and that can take some time and can be quite difficult for patients. So when we're prescribing as doctors, we want to try, in my opinion, to be mindful that what we're doing can have longer term consequences, and we want to make patients aware of that some medicines, especially some medicines, can be very difficult to taper off. And when we're prescribing something, we're creating a domino effect, at least potentially. So if we're prescribing an antidepressant, that could cause weight gain, sleep changes, low serum sodium level, so various things that we may not that the patient, for example, would not know about necessarily, but that can be quite significant. And like I mentioned, analogously to medications, if we're adding a supplement, a vitamin, or a food, then we're also potentially intervening in the balance or changing the balance of the natural biochemistry of a person. Thank you.